My name is Karshe Yusuf. I am one of the orthopedic juniors at Medway NHS Foundation Trust. I just wanted to talk about a project that we did locally, looking at the outcomes of gastrocnemius recession in patients with painful foot and ankle conditions. So a bit of background. There are various treatment options that are described for patients that have painful foot conditions, both operative and non-operative treatments. Usually the equinus contracture deformity is thought to be responsible for these painful foot conditions, things like Achilles tendonitis or plantar fasciitis. So traditionally, the gastrocnemius recession is performed for correction of the gastrocnemius equinus contracture of the ankle, and we wanted to look at how the outcome of these patients undergoing these conditions and this procedure locally are. It's used to manage, as I said, patients suffering from conditions like plantar fasciitis or Achilles tendonitis. Usually the first line of treatment would be conservative management, but those that fail or have persistent pain could go on to having a gastrocnemius recession. So the objective of this study was to review the outcome of this procedure in providing pain relief and also patient satisfaction. Patients that are suffering from the plantar fasciitis or Achilles tendonitis, and these are patients who have failed conservative management initially. So it was a retrospective study going through patients that underwent the procedure from 2011 up to 2020 locally. The exclusion criteria included those that had structural deformities or anatomical deformities, because these patients we were not going to be able to accurately assess whether the procedure was beneficial or not. The outcome was recorded using a visual analog score and a patient satisfaction score. Interviews were conducted after gathering these patients' details from the database, and they were interviewed individually. Other data that was collected included demographics, any complications that the patient had, and what was the follow-up of these patients like after the procedure. So the results, a total of 35 patients were identified who underwent a total of 40 medial gastrocnemius recession, 6 of which underwent bilateral procedures. Of these, 21 of the patients had Achilles tendonitis, while 14 had a diagnosis of plantar fasciitis. Again, all these patients are those that failed initial conservative management and then were put on the list for gastric recession. Follow-up week was about 22 weeks on average, ranging between 6 earliest and 56 latest. One patient was unable to record the visual analog score and the patient satisfaction. This is an elderly patient with cognitive impairment, so that patient was excluded. All the other patients had an average of a preoperative visual analog score of an 8, which went down to a 22 postoperatively. So we can see that there was a clear impact and there was a good outcome from the procedure. And 30 of these 35 patients were satisfied with this procedure and did not need any further follow-up or treatment. So basically, in conclusion, what we found was that provided with appropriate patient selection, patients that would benefit from this procedure after having failed conservative management, gastric recession would be beneficial and is effective treatment in treating certain painful conditions, such as plantar fasciitis and Achilles tendonitis. Of course, this was a small study that was done locally, and that is one of the limitations that we had in this. A more accurate study would be to increase us to do a larger scale study with more number of patients, but in those number of years, we only had a total of 35 patients at our local hospital, and that is what we work with. Thank you very much. Does anybody have any questions?